When I looked at myself, I didn't really connect to my body. It felt like I started feeling detached and like it wasn't me, but I didn't really know what that meant.
That's how Olivia Venderspool says she struggled with gender identity. Venderspool is a transgender woman who began her transition in 2019. She says she struggled to find reliable information and government resources lacked social transition guidance. In 2019, Vanderspool began hormone therapy. A mental assessment was required, and long wait times mean she had to pay a private psychologist to move forward medically in her transition.
I did that privately, and I was working a part-time job through high school, so I used some of my own funds to pay for that.
After waiting 4 years, Vanderspool had surgery in 2023. She says receiving hormone treatment is still complicated. Micah Dowie is Executive Director of Trans Non-Binary Rights Advocacy in Nova Scotia. She says not all doctors are authorized to prescribe the medications needed for hormone therapy, which makes accessing the healthcare system difficult.
I think one of the biggest challenges is finding a doctor that is willing to work with you on those things. And there's also, of course, the trouble accessing a family doctor in Nova Scotia at all right now. So.
Vanderspool says she fears accessing care for trans people will get more complex with recent political messages by Canadian Conservative leader Pierre Poilievre and US President Donald Trump.
I'm worried that a lot of us are going to feel even more scared to reach out to our doctors and take the steps to receive medical care when we're seeing headlines from America, even in Canada.
Nova Scotia's 2023-24 budget allocated $1.7 million for gender procedures, which allowed for nearly 380 surgeries. With shifting politics, the future of transgender rights in Canada remains uncertain, but for people like Vanderspool, access to care is a right worth fighting for. Magda Bastida, WTV, Halifax.